It's about 11 and a half months Quinn had been in the hospital when they first started talking about discharge. Everybody was really excited. I mean, we'd certainly seen lots of people come and be discharged, and, we thought, oh, one day it'll be our turn. And so now we were having discharge planning, and that was really exciting. And every day for at least a month before discharge, and no exaggeration, every day someone would say to me, you must be so excited that Quinn's finally going home. And I would dutifully say, yeah, I'm really excited. And inside I was saying, I'm just the worst mother possible. I'm supposed to be excited. See, everybody around me thinks I should be excited. So I'm supposed to be excited. I'm going to work really hard on this being excited, because I was just terrified. I'd had one-to-one support for almost a year. It didn't matter if I made a mistake. There was always somebody there to help, or if I didn't know what I was doing, I could get someone else to do it. Now I was faced with taking this child home who was 100% tube fed and had a tracheostomy, and I was going to be solely responsible all by myself. The other thing is, I'm a very social person, and the idea of being now without colleagues. I had gone from being a working person to having Quinn, and in my mind I commuted to Children's every day to do his care, and that was my new job, and these were my colleagues, and now I was going to be thrust out into the world on my own with no support and no colleagues, and then it became this thing of, oh, we have to get him home before Christmas. Of course everybody wants their baby under the Christmas tree, and we'd already spent one Christmas in Children's, and so, yes, it became this thing of, oh, we have to get him home for Christmas. Well, we have no family in the province. It wasn't like we were going to have some big family dinner with our baby. And then it became obvious that over Christmas holidays, there would be no home respite nursing, because all of the nurses take, like, the week between Christmas and New Year's, everyone has off. And so no one was sort of thinking about all those everyone was just picturing, this baby under the Christmas tree, and we had to get this baby home for Christmas, and I got caught up in it too. It was just like, oh yeah, we have to get the baby home for Christmas. And when I really thought about it, I thought, well, I don't really know why. And then we got home, and it was as bad as I had feared it would be, frankly. Really isolated. It was Christmas holidays, and everybody else was off celebrating with their families, and we were home now all by ourselves. I mean, my husband and I, with this baby, and we were all on our own. And I felt terrible. I felt terrible for at least the first month that he was home, because I just was, in my mind, secretly was saying, if something were to happen, I'd have to take him back. Or I wish they would call, and, if they called and said he could come back, I'd take him back. Because I was so out of my element. The assumption was I'd been there, we'd been there for a year. We certainly knew how to do all his care. We were doing all of his care. And so, we would be fine. And I was afraid to say what I was really feeling. I really felt abandoned, actually, that first month home. We'd had the same people, the same doctors and everything looking after him for a year. And then we got home. I think we'd been home for, about 3 days the first time I pulled his G-tube out. And I called ICU. I mean, those are the people I knew. And the response was, well, you're out of here now. You're not our responsibility anymore. And it was, that was a really bad experience. I was like, but I don't know who else to call. It's Christmas. There's nobody in my GP's office. I think after a while I just started to believe that I was supposed to be excited, so I was. Our discharge was as if you were trained as anything. It doesn't really matter. You're a plumber. And then one day somebody comes to you and says, you're not going to be a plumber anymore. as of next week, you're going to be an airline pilot. So we're going to put you in the cockpit. Come along, watch what we do, and it'll be okay. So for a couple days, you watch what they do, and then they say, okay, now we're going to sit here beside you and help you fly the plane. So now you take over the reins, and we'll just sit here in case you make any mistakes. And then, you know, after a week of that, they say, okay, tomorrow you're flying on your own. And that was exactly how we felt. It was like, okay, yeah, well, we've seen how to do it all, and we've done it. But this idea that suddenly now we're the pilots of a jet airplane. I was like, yeah, I'm not really trained to do this. When you think, you know, nurses and doctors go to school for how many years to learn how to do all of that. We were just thrown in